the Doctoring Differently podcast. I'm Dr. Naomi Lawrence-Reid, your host, pediatrician, and creator of the Doctoring Differently digital course that teaches physicians of all specialties how to find and explore lucrative, flexible careers beyond full-time clinical medicine. For more information, visit doctoringdifferently.com. Today, I'm pleased to welcome Dr. Kiyonna Jones to the podcast to discuss medical directorship for physicians in the MedSpa space. Dr. Jones is the CEO and founder of Luxe Beauty Academy, where she teaches nurses how to explore entrepreneurship in the MedSpa and aesthetics industry. Dr. Jones received her bachelor's degree from the University of Southern California, followed by her master's and PhD from UCLA. I'm so excited about this conversation and about all of the guests on the podcast. You won't want to miss any of them. Subscribe at Spotify, Apple Podcasts, or wherever you get your podcasts. And subscribe to the Doctoring Differently YouTube channel to watch all of the episodes on YouTube. And now for my conversation with Dr. Kiyonna Jones. Well, today on the podcast, we are so glad to have Dr. Kiyonna Jones with us. Welcome, Dr. Jones.
Thank you. Thank you for having me, Dr. Naomi.
You're so welcome. You're so welcome. And before we get started, I do want to just clear the air a little bit. These days, there is a lot of conversation about nursing scope of practice and misrepresentation of nurses, particularly nurse practitioners as autonomous providers.
Yeah.
The autonomy of nursing practice can vary state to state, but because Dr. Jones and I are both in California, we're most familiar with the laws here, so we'll speak more freely and more frequently about what happens here in California. And by the way, of course, Dr. Jones is a nurse who holds a PhD, so I will be calling her Dr. Jones. And this conversation will center around the world of medical directorship in the med spa and aesthetics industry and the intersection of physicians and nurses in this space. So, and now that I've gotten all that out of the way, Dr. Jones, why don't we open the conversation and tell me a little bit about your nursing school experience and how you saw your nursing career moving forward.
Okay. So, of course, my dream was to be a nurse. When I started school, I actually obtained my bachelor's degree in public health. It was called Health Promotion Disease Prevention from the University of Southern California. So I did not go into nursing as a baccalaureate as my first degree. I actually went and I obtained my master's degree. So I have my master's of science in nursing. I went to UCLA. And that was actually so long ago. I'm dating myself, but we were the very first program. They were kind of trying out. It's called the MECN program, Master's Entry Clinical Nurse Program. So we started out and it's like multidisciplinary. Like I was in class with anthropologists, like all these different backgrounds came to become, they wanted to be nurses. And so you can imagine it was very rich experience. And so in my mind, I thought, well, I've always just wanted to do whatever the top is. So my goal, my sights were like, what's the highest? What's the most of whatever I can do in nursing? And I was like, well, I want to be in leadership. So I decided I wanted to go on the path of like leadership. I wanted to be a CNO at some point. And so I realized that even though I wanted to go straight to leadership, I really did not want to work too long at the bedside. I knew I was going to have to work at the bedside first. And so I worked there full time. Yeah, for 3 years. I worked full time there. And I actually worked at the VA. And so it was miserable for me. I'll be honest. It wasn't an enjoyable experience. And so when I left, I decided that I was going to just figure it out. And so I had never worked full time ever again since that. Not in clinical. So I was full-time in academia, but that was different. It's like 19 student contact hours. So it wasn't like that whole 40-hour a week. So I did that. And on my journey, I just experienced just realizing that what I was in search of was not going to be accomplished as anyone's full-time employee at any capacity. And then as I started to go up the ladder, I realized, wait a minute, it's going to be even more responsibility. So,
That's
and
right.
accountability.
That's right.
So now I'm
That's right.
working 40 hours. I might be working 60 hours a week,
Okay,
80 hours.
hold on. Let me just backtrack and just get so I can get the timing right. So
Yeah.
you initially in nursing school had a vision for leadership. So you weren't someone who went to nursing school or was in nursing school thinking, oh, I want to be a bedside. Okay, you already had visions of leadership. Great. But
Yes.
you get out, you got your bedside experience, maybe not the most enjoyable. You recognize this is temporary. I'm moving up. We got to
Yeah.
leadership, these leadership and maybe administrative roles, and you said maybe this also isn't for me. Is that where we are?
Exactly. Yep, that's where we
Okay.
are. So
Okay.
so I worked in academia at the same, like I had three jobs at once. All right. If you guys know
Okay.
nurses, you know that we have multiple jobs. So let me just say
Yeah.
that.
Yeah.
But
Okay.
I promised myself I wasn't going to commit like full time to anyone.
Okay.
Right. But
Okay.
as I was going through the process of like kind of trying to navigate to get to this space that I wanted to be in, which I thought I wanted to be in as the CNO, I realized that it was going to require not only 40 hours, but even more. Because now I could
Right.
be off and they could be calling me.
That's
There's
right.
never really a break. And I was like, well, that's not what I want either. Because ultimately, I was looking for freedom and
Yeah.
flexibility and the
Yeah.
ability to have control of my life. And I realized
Okay.
that was
Okay.
not going to happen in leadership. So
No,
that's where
no.
we are
So
right now.
that's where we are. Got it. All right. So academics, leadership, also kind of you got there, like I'll say, like physicians get to that place we thought we wanted to be. We thought the attending life done with our residency, done with our training, thought that is the end all.
Yeah.
And then we get there, we arrive, all of the years, the sacrifice, the debt, and we
Hmm.
maybe aren't as happy as we thought we'd be. And many of us are a
Hmm.
little ashamed or embarrassed, and we just press on and keep going. But this
Yeah.
podcast and so many of my guests chose another path. And so this sounds
Yes.
like the time of the pivot. So
Hmm.
when and how did you start looking outside of bedside nursing and academia and leadership and those more conventional nursing roles?
It was so crazy. I started going through this journey where I was like just hungry for more information. And I
Okay.
just knew that there were people out there who were in the position that I was in, who was living the life they wanted to live. And for
Mm,
me, if there was one person who could do it, I know I could figure out a way that I could do it.
sure.
So I
Yes.
began this journey of just self discovery. What do these people know that I don't? Because I
Mm,
was in such a box. Mind you, during that whole time is when I obtained my PhD. So I was in a program
okay.
for 4 years. In my mind, the more educated we become, the more institutionalized we become, the more
It's
in a
so
box we
true.
become, right? And
So
so
true.
the
Yeah.
more I went to school and I'm trying to fix this thing that I feel is broken, I realized that
Yeah.
that wasn't the route to take either. But anyway,
Yeah.
I digress. I completed
It's
that
okay.
program, but as
Uh-huh.
I was going through it, I said, there is something more. So I just started to listen to motivational speakers. Like my first step
Okay.
in that was like I hired a mindset coach, which was
Uh-huh.
totally unorthodox. Mind you, everybody thought I was
Uh-huh.
crazy, which I would have thought I was
Mm,
crazy back then too. I always say, you got to be a little crazy to go against the status quo. You just have to
you,
be, because
you,
like
you,
other
you
than
kind
that,
of
you're going
do.
to be normal and kind of fit in where everybody else fits in. And so I had a little
Mm-hmm.
delulu, right? And so I hired and invested in this mindset coach, and she changed my life. She really put things, and then of course,
Okay.
the mindset, listening to the different mindset motivational speakers also changed my life. So I was doing that
Mm-hmm.
simultaneously, and I just realized that not everything, 80% of what I had learned
Okay.
for the life that I
Yeah.
wanted was not in alignment.
Mm-hmm.
So when
Mm.
I talked
Mm-hmm.
about, the time freedom, spending time with my kids, having
Mm-hmm.
no limit
Mm-hmm.
to my earning potential, just being
Yes.
able to say one day, I don't feel good. I'm not going to work today, but I still got
That's right.
money coming in. Like
Right.
that mindset did not align with the path that
No.
I was on.
That's right. And I liked the part where you said, you talked about the more education, right? That's so much of our currency is education.
Yes.
That's the American dream for most of us. And that, that's the key to maybe breaking generational cycles or, leaving bad situations or the immigrant dream for many people. It's you come to the United States for people who come and people who are here. No, the more educated you get, that is the key to the life you want. And and I think many of us have found that is mostly true, but then I don't want to say you go too far, but when you continue to go, we get more residencies and we do, physicians will do fellowship after fellowship or more degrees and more degrees or a PhD or an MBA or an MPH, we will keep going. And not that there's not utility to education but so much education doesn't really need or necessitate degrees. Was it Mark Twain who said, don't let education get in the way of, nope, I'm going to say that wrong. Don't let, help me out. Don't let, don't let your education this is it. Don't let education get in the way of your learning. Pretty sure that's how it went. So, learning can happen, but as you described, you yourself and educated and academic at some point, professional, we think that the more we go, the better the life will be at the end. But I think that's when the American dream maybe turns into less of a dream. Right. And you realize you're stuck in these institutions, you're over-specialized, overqualified, and maybe put in more of a box. Okay, so it sounds like the light is starting to come on for you. You are you've got the mindset coach, your mindset is changing, it's shifting. You started to talk about talking to other people, which I harp on and talk about a lot. So who did you start to talk to? How did this change in this movement start to happen?
Yeah, so the first thing was, like I said, the mindset coach. And so, of course, with a good coach, they're going to have, you should have homework exercises, things that you are actually doing actively when you're working with them to try to kind of break down the walls that you have up, whatever it is, right? So for me, it was mindset. And through that, and also listening to motivational speakers, the discovery was for me that I was really I had limited myself by just continuing to surround myself with the same people, by not having any plan that was linked to my goal in life, right? It was like, they didn't talk. They were like two separate things. It's like, I had to realize that what I wanted in life versus who I wanted to be in life, they needed to be in alignment. And they weren't, because we all are rewarded as healthcare providers, right? And, and that's really hammered in us early on in our educational journey, right? Like this, you can't do this for the money, you really have to care about okay. And then you start feeling guilty, right? So I was going through all of that, but then I'm over here on this other side and I'm like, listen, I love what I do and I take dang good care of my patients, but at the same time, I want to earn more because I know what that leads to in my life, my kids' lives, and I don't want to do that working 12 hours and 40 hours, however much you working as a nurse practitioner, they may work 40 hours a week, but as a bedside, you have the 36 hours a week, but I was tired, so I just had to realize there was a disconnect that I had to bring together. And that's what my mindset coach made me do. And some of the activities she had me do was like, start talking to people, show up in rooms. And I was really trying to stay in my comfort zone and do that. And there's just no way, no humanly possible way you can grow in your comfort zone.
So talk to us about how you entered the world of aesthetics and then how you found your first medical director. Let's go there.
Leaning and leveraging the tools that I learned from my mindset coach. I said she wanted me to talk to more people. One day, working out with a lady that I rarely talk to, but we used to set each other up for our class, weightlifting class. And then one time she mentioned that she was in business. And I thought, that was like, I wanted to be in business and I didn't know
Yeah.
anyone who was in
Mm-hmm.
business. And so
Okay.
I started asking her questions. I usually would not have done that, but I was like trying to step outside of my comfort zone. And I'm like, I'm going to
Good for
talk to
you.
her. I'm going to ask her. I
Yes.
started asking her questions and
Okay.
really she helped me. She allowed me to rent her space. She had an extra space. I
Wow.
rented her space. And then I just got
Okay.
hungry. I started going to
Okay.
trainings. I started,
Okay.
connecting, going to conferences because I had started to realize like all the things I was doing was
Uh-huh.
not going to lead to where I wanted to be. So I started to do the opposite. I started to do the things
Okay.
that made me
Sure.
uncomfortable intentionally. Go ahead.
Now, was this woman in aesthetics?
She
How
was.
did we get to aesthetics?
She
Okay,
was
so
not.
she was not.
She
She
was
just had the
not.
space. You went out. It sounds like you took a step of faith, a leap of faith. You
Hmm.
rented the
Hmm.
space,
Hmm.
and then you pursued classes
Hmm.
in aesthetics at that
Yeah.
point. Okay, so
Yes.
what were the classes? What were the topics?
Okay, let me just give you a little background. She was a retail clothing store. She had a retail clothing store,
Oh,
just to show you how
understood. Okay.
far it was from me.
Uh-huh,
And
uh-huh.
she's an Indian lady, and she had a
Okay.
retail clothing store. She sold like Hindu attire, like
Okay.
it was like that, just
Sure.
to show you how way different than it was for me. But she said to
Okay.
me, she said, you know what? I had no idea what business I was going to start. She said, you know
Uh-huh.
what? What if have you heard
Wow.
about this micro needling? Have you heard, I mean, not micro needling, microblading? Have you heard about permanent makeup? And I'm like, no, I knew nothing about it. So after we talked,
Wow.
I went home, I started researching. So my first venture into like beauty was not medical. So it was
I
from there.
see.
So I did the permanent makeup. It was great.
Mm,
I had trained, I planned, I did all this stuff, and I did really
got it.
well in that space. But
Sure.
I started to feel like I'm not
Okay.
leveraging my license
Sure.
enough, right? Like
No. Right.
I'm a nurse, and so then I collaborated with my medical director at the time. He came on board, and he was just so supportive. He's like, "Listen, I love what you're doing," and he was just willing to work with me. And we started doing weight loss, and then from there, I
Okay.
trained in the top treatments, which of course is the beginner's
Okay.
Botox. Of course, we did the toxin training, and then the dermal fillers, and then
Mm-hmm.
I've trained now on sclero,
Mm.
PDO. Like I've done a lot, but I started with the toxins and
Yes.
the dermal fillers.
You're right.
Yeah,
That is the start. Okay.
yeah,
Okay. Now, okay, you mentioned you had a medical director. Did you need a medical director to do microblading? And we're in California, so we know about the
no,
laws, but did you need one for that in California? You
no,
didn't. So you were able
nope.
to just do micro. That's more of the aesthetics round, like just like,
Tattoo. Think about
hair,
tattoo
nails,
artists. It's like tattoo.
tattoo. I
Yes.
understand.
So
Okay.
they
Sure.
actually was crazy. The
Uh-huh.
Department of Public Health comes and inspects me for my permanent makeup side of my business. They don't inspect for aesthetics because
Wow.
they're leaning into your like as a
Sure.
provider.
Yeah.
You're educated in that, so it makes sense. At first, I was like,
That's true.
they come, they check if your water is hot, if you're, they really do look at your
Uh-huh.
consents and all that. But it makes
Okay.
sense because that they don't do it for the aesthetic practice, just because you're a
Sure.
provider. So
That's right.
medical
That's
provider or
right.
nurse practitioner. Yeah,
Okay, all right.
yeah,
So so you were doing microblading for eyebrows and permanent makeup,
yeah.
and then at what point did you discover you needed a medical director, and how did you find that person?
Yeah, so I started researching, and I'll be honest with people gatekeep, and I don't. I'm not a gatekeeper at all. So I started,
Yeah.
and no, I couldn't figure out how to do it. I'm looking at now, mind you, at the time I had my master's degree, and I was in school for my PhD, but still not advanced practice. So
Okay.
in order to have a med spa, I could practice under my nursing license, my RN license that I get from BRN, right? And
Okay.
but I'm looking at all of these different med spa owners who are not advanced practice. I'm like, what do they know that I don't? And I think that's a question
Mm.
that a lot of people should ask. It's not what you know,
Ah.
it's what you don't know.
That's another word today. It's not what you know, it's what you don't
It's
know.
what
And
you
if you
don't
see
know.
people who know things that you don't know, time to pay
Mhm.
attention. Okay.
Yeah,
Got it.
and you have to ask the right questions though.
You
So
do.
my
You
question
do.
was, what do I not know? Like, what do they know? So
Mm.
long story short, started researching, and that's when I realized, like, I looked up like the state laws of California, and I'm like, oh, 5149. I can
Okay.
actually as a nurse, can own a medical practice, not majority, but I can own a medical
Sure.
practice. And
Okay.
then from there, I just realized that was so inspiring for me because I thought that we could not, which most people
Yeah.
think that. And so
Mm-hmm.
from
Mm-hmm.
there, that's when I started to collaborate with my medical
Sure.
director. We started with weight loss first, and then I started
Okay.
doing IV therapy. And from there, I
Okay.
added the aesthetic piece.
And what you said, I'll extrapolate to physicians. We as physicians don't think that we can step out of our, specialty training. So for you not thinking or knowing you could own a medical spa, I didn't think I could either as a physician.
Yeah.
So look, all of us are kind of waiting around in the dark for a little bit. But it was a surgeon who told me over a dinner party once,
Yeah.
hey, you could own a Botox and filler med spa. And I thought, why? How? I'm a pediatrician and I'm looking at him like, you're a vascular surgeon. How can you? And he looked at me and he said, you do harder things every day. You are doing, lumbar punctures in babies and infants, and other procedures and sutures and faces. And he was right. And he said, you do harder things. You can learn how to do this. But as you just said, I also, and many physicians simply do not know that we can be, in conjunction, we can open our own med spas, but we can be a 51% owner and an advanced practice provider, or PA or NP, be a 49% owner of the same practice and have some sort of collaboration there.
I have to say, I don't think it's by accident that you didn't know or I didn't know. And so, yes, and I was lead faculty in public health for this educational institution for baccalaureate nurses, and I fought so hard to try to get nurse entrepreneurs in my class. I'm public health, so that would be the perfect place for it, and they refused. And I have worked with doctors as well, and I realized you guys didn't know either. Like
We don't
it's
know.
not being taught.
No.
And
No.
I call it a pipeline. I can speak more in depth from a nursing perspective because I've been on curriculum committees. I've seen the plan from orientation to graduation where they want us to go. And I think it's probably very similar for physicians wanting you to ultimately, be an
Very much so.
employee or definitely not be independent.
That's right.
It's not a
No,
priority, which
I
is
think we can
crazy
just
though.
say it.
That is
No.
it's not a priority.
It's crazy that what? Say that. Finish that.
I was going to say it's crazy that it's not a priority. Although I almost think about it as in, if you want it, you got to go get it. It's not coming to you when it comes to this entrepreneurship thing.
That's right.
Which is why there are so many people who are less educated than us doing very well because they have the hunger.
That's right.
They're like, I don't care what.
And the hustle. Yes.
They don't ask for permission.
No, that's it. I've said that I'd rather ask for forgiveness than ask for permission these days. Just start, just go, of course, within boundaries, within laws, please don't go crazy with that quote. But exactly, you've got to go for it. You have to go. Again, okay, tell me how you found your first medical director and how that first conversation went.
So what's interesting, I work with nurses and I teach them how to build their own meds. Like I'm the person that I needed, right?
Yeah.
And with him, I would not recommend going this route now.
Okay.
But at the time, we were colleagues. I was just posting on social, like, just talking about my journey. And he's like, hey, what do you got going on? One day we were at work and he's like, what do you got going on? And I'm like, well, this is what I'm doing and this is where I'm going. He's like, let's meet outside and have like a business meeting. I'm like, okay, let's do that. And so we got together and then I just talked to him about what my plan was and where I saw the business going and just about the industry as a whole, how it could benefit him, how it could benefit me, us partnering on this. And he was game. And so that was it. We worked together for a long time. It was good.
That's good. Well, it sounds like your gifts spoke for themselves. You already displayed the work ethic, the, intelligence he already respected and probably admired what you were doing in the hospital and recognized, okay, success is going to follow this woman around. And that's how that began. Okay. So if we could just talk again for the physicians who are looking to listen and learn a little bit about what that relationship looks like. If I'm correct, you don't work with that medical director anymore, but but it was, in the state of California, these practices have to be S Corps, correct?
Yes.
And 51% owned by a physician, 49 by anyone technically, but by an advanced practice practitioner now.
Right. And so the S Corp is a tax filing designation, but it needs to be they term it as a medical corporation, which is a professional corporation. So AKA, right? So they're synonymous.
Got it.
But in Cali, they call it a medical corporation. And essentially, the way I break it down to lay people, and I'm a lay person too, so that's why I'm able to do that. But the way I break it down essentially is it ties to your state license. So if you're an attorney, it ties to your state license. If you're a physical therapist, it ties to your state license. So you are operating within your state license. Then you need a professional corporation in California. California. Now, when it comes to the doctor-nurse relationship, the physician needs to own majority ownership. And by law, healthcare professionals can own the 49%. So it doesn't have to be an advanced practice or a PA. It could be, like I said, a physical therapist. It could be an occupational therapist. But it has to be licensed. So it can't be an LVN, LPN, for example. So it's like an RN, PT, OT, whatever. So they can have minority ownership. Now, when it comes to the actual practice of it, that's different, which is where people get confused, because you might be saying like, well, how in the heck can a PT own a medical practice? And the answer to that is that has nothing to do with the practice of aesthetics. So that's ownership. And then the other one is like, can you within your scope of practice inject or whatever, and so that changes. So you can be an owner and never practice. But in Cali, a lay person is not able to own a medical practice. Now, what they do is they partner with the non-medical. It'll go into a long thing, but essentially,
understood. Okay, that sounds like the advanced version. Because I do know that other states, like I believe the state of Washington, a corporation is not necessary. A PLLC is what's necessary. So, how would how would a provider who's listening anywhere in the country, maybe anywhere in the world, how would they find their own state laws? Where could they look for that?
So a medical board is the first place I would go. Honestly, I tell my nursing clients also to go to the medical board, because the medical board is they are over medical practice, right?
Sure.
Now
in that state,
your local So if you're Washington, the Board of Medicine, state of Washington, whatever they title it, but your medical board is where you definitely should go to. I think the biggest mistake people make trying to figure out these things is they put in the wrong search terms. They put in like MedSpa owner, which really they'll call it cosmetic injectables, right? They have those type of names that we wouldn't normally use. But I would go to the medical board. I would also, for physicians, it's just a matter, any state in the United States of America, you can own a med spa as a physician. Right. Let's just start there. That's right. So when I work with physicians, I'm happy because I don't have to deal with like red tape. I just know they don't know the logistics, and they may not know all of the legalities, but I can, I help them easily just because it's like, oh, you got a license. Oh, That's good. Right. Like, that's right. I know. We know we have a license, and I think that brings in the next topic is, well, why we're so hesitant and reticent to enter the space. And we know it's because of risk. We don't have a lot of education around the business aspect. We don't feel smart about it. We feel educated about the medicine that has been drilled in us for decades. But this part is so foreign and not new, and we don't know where to find, credible information. And then it's the risk of our license. Okay, someone else is working on under our license. Yikes! I could lose everything. I could lose all of it. So what would you say? Or I know we can talk screening protocols and other things that happen between an APP and a physician collaborator, but how do you kind of mitigate some of that risk? How are you both protected in this business arrangement? Yeah. So my thing is, and this is something that I when I work with doctors and nurses on, it's like, first of all, we have to understand that this is business. So this becomes a business partnership, and it's not hierarchical. It's like you are expert because you are the
That's right.
medical provider, right? And
Right.
they may be the nurse practitioner or physician assistant or RN, so they're skilled in their space.
Right.
But your communication with
Mm.
the nurse practitioner, the injector, let's just refer to them as an injector,
Okay.
will
Injector,
be
sure.
will be based on your protocols, your policies that you have
Mm.
put in place. Okay.
Right.
And
Okay.
so
Yeah.
that's the communication piece. So a lot of times there's a confusion because doctors are like, well, don't I need to be there? It's like, no, but your practitioner, whoever that is, MPPA,
Mm-hmm.
they need to follow those protocols.
Right.
That is decide, like your state decides that. So like you mentioned
Exactly.
Washington, and the state of Washington, MPs have full practice authority. So they can own
Right.
their own med spa, they can be their own
Right.
medical director, they're good, right?
Right.
Versus in the state of Texas, the physician has to have 100% ownership. They're not even a
Oh, interesting.
51-49 like Cali, right?
Oh,
So yeah,
okay.
way different, right? And
Yeah.
and so in that perspective, with Texas, although Texas is a whole nother, but anyway, with Texas, the communication is through those protocols and those policies, and with the
Understood.
understanding that the nurse practitioner or nurse will follow them
Got it.
with
Got
the
it. So
presence or
that
absence of the physician.
understood. So I think that that's an important part to make and to emphasize here is that early coming together between an APP and a physician, medical director, we use the term medical collaborator, you're putting those policies in place together. There has to be a trust, a respect, as you described with your first medical director, but also then putting those policies in place so that it's not just, oh, yep, they're over at the spa. I'm not sure what they're doing. They're kind of using their own judgment. There's a reason why a physician might be involved in that early part of it. The screenings, if we're screening for, say, IV hydration therapy, we talk about IV hydration clinics, and there can be danger, right? If not every person who walks through the door needs to get an IV bolus, whether they request it or not. So let's make sure that we have the correct screening protocols in place, and we have all of those documents that are in accordance with what the physician wants, the nurse. Let's come together to make it a safe, most importantly, a safe practice.
Yes, and I've done a deep dive on this in the state of California and in Texas because most of my clients are like Cali and Texas. And what
Okay.
I've realized, like my big takeaway that I want physicians to know is think about public safety. And if you are a collaborator and you're working with a nurse practitioner and you have not been trained on sclerotherapy, but they're providing sclerotherapy, then how can you sign off on protocols
Right.
without it? Now, your level of training doesn't have to be like, oh, you have to have 5 years. Because, see, we always go to that employee mind where we're like,
We
how
do.
many years of experience? Like, girl, you're a provider. You don't have years of experience. Did you train? Do you feel confident and competent? Okay, then you can delegate to the practitioner in your who you're collaborating with on these are the correct protocols. Now, the great thing about it is you don't even have to create them because when you get trained, they provide protocols, but you will want to review them, make sure they're in alignment with what you agree as a medical professional, and then you sign off on them. So I think it's like, I don't know if I can do it. You can't. You just train and then safety.
That's right. Train and safety. And yes, I will say a number of people ask me, well, where did you get certified and how did you certify? And it's like, okay, I too learned along this way even as a pediatrician. I have MD behind my name. I can do this. Quite frankly, good and bad, didn't even need to officially get the training, but I did. And that is our personalities, right? So many of us, we're not mavericks. We don't want to just start shooting at the hip at, we want to train and learn and get good at whatever this new venture or feat is. And I, like you, just started taking a number of courses and maybe took, I think 4 or 5, Botox injectable courses and said, you know what, I can do this. Yes, I can do this. I do harder things and I now feel comfortable. And so I think what you're describing is actually comfort and trust in ourselves and our own abilities. We're so used to having to get the validation from an institution, from University of XYZ and so medical center. They give us a diploma, they give us a certificate and say, okay, now you go. But at least as physicians, after we can trust our own comfort in
Yes.
whatever this new skill or new venture is, within range, and trust ourselves. Again, we are very conservative. We want to mitigate all risk, but there is a degree of taking a chance in this space, and with all the safety first, but it can be a great and fruitful relationship with a with a collaborator after.
And what I always say, like, just from being in this space for so long now, it's like I can see it. What we do when we go to school, we train, we learn. And I'm going to speak from physicians, since that's more of your audience. You go, you train, you may do you do your residency, you may even do fellowship, you may just keep going, specialize, whatever, and then, but it's all been like in systems that are already built. So that's where you get the sense of security and comfort. And so the truth of the matter, and what they didn't tell you and what they didn't tell us, is that it is your license. And so you're trained to go out, but that means that you're going to have to create your own systems. And that's what's scary, because it's like, I don't know the first thing about like protocol. You don't know that, because all you usually have to do is go and get on a computer and like look and see what the protocol is for this.
Pull out the big binder. That's
exactly.
Right.
So now you have to create the big binder. But I always say, to whom much is given, much is required. So if you want to really embark upon this, then step into that. You can. You're qualified. Right. Yes, it's not going to be easy. We all know that, right? But it definitely will be worth it, because you will have the life that you want.
That's right. That's right. So tell us what is your current business now? I know you have moved around. You have explored all kinds of things. And now you're teaching both physicians and nurses about this field and how they themselves can be entrepreneurs in the aesthetics space. Talk a little bit about that.
So I still have my MedSpa. And when I first started this whole journey, I just saw myself like with this, 10-room spa, and like I was going to have all these employees working for me, and it's just going to be great. Well, as I started going the journey, I realized I like being a supervisor, but like if they don't do something wrong, I don't want it to be on me. I like to be on the powers that be. And so I realized soon after, probably a couple years, I was like, I don't want to be the owner and CEO of all of these people. It's not enjoyable. And I didn't come into this to do something that I don't enjoy. I did that already, right? So on that journey, I decided to start renting out. So now I rent out my rooms. I lease them out. So I have like a little aesthetic suite, and I, as an expert, am able to support new nurses who are going into this space. So I have that space, and then I have an online academy. And so essentially what I do is, like I said, I help nurses become the aesthetic business owner, following a framework that I built from just doing this for so many years, and really trying to find the quickest possible way to achieve profitability and to get the things that you desire in life. Now, from that, I've worked with physicians who came in my program, and I always thought why I asked them, because I want to know, like, because you hear me nurse, and sometimes that would deter a physician, like, oh, this is not for me. And so the ones that do come, they're like, because essentially you are the only one that provides this much value, and so I want to come and work with you, because we know if you can help nurses, you can help us too. And I'm like, well, you're right. So I started doing that, and then from there, now I've been helping physicians build collaborative partnership companies, where, because I have the nurses already, so these are the physicians who want to partner with nurses. These are the ones who see the value in us as a collective, and not like this hierarchical relationship. Like, so one of the things I do when I work with them, but I interview them first to see if we're a good fit, because I don't want to work with anyone that's, you get to that point where you can say no to money. Like, that's the goal.
That is the goal. That's a nice place to be. That's right.
Exactly. So if it's not a good fit, so I usually interview them just to find out what their perspective is as far as the healthcare system, like why they're pursuing this, what they think the dynamic would be between the partnership with nurses. And so in doing that, just building out this way to partner with nurses, generate passive revenue. And it's not all passive. There's nothing that's all passive, by the way. But in terms of how people describe passive, it would be passive because you work way less and you can make way more. And so far, my provider, he's doing really really well, working with
Great.
multiple nurses. And it's
Great.
really, really good to see that, he definitely has the mindset of like,
Right.
I really want to partner with nurses and be supportive of them,
Mm-hmm.
but also provide value in order to kind of step back. Because he was one of those 6 days, 12-hour day,
Yeah.
a week. It's crazy. I'm
Mm-hmm.
like, how in
Mm-hmm.
the world are you
I
doing
know.
this?
Yeah. Well, we're told we have to, so we do. Yeah, that's exactly right.
Yeah.
Okay, so I think you also touched on an important part that I wanted to mention, and that is if you a physician are considering entering into a collaborative relationship with a nurse practitioner, PA, being trained and having familiarity with what they're doing. If they're doing
Yes.
injectables, you've taken at least an injectables course, or if they're doing, IV hydration or hormone replacement or weight loss, that you have an understanding of that. That's the only way you could have some insight in creating those early screenings and protocols.
And it
So
can be
what would, yeah.
online, by the way. It doesn't have to be in person.
Okay.
Like you, as the listen, they know that you guys are
Sure.
going to be supervising. That's
Uh-huh.
understood, right? What do?
Right.
You put in orders, right? That's what you
That's
do. You
right.
put in orders.
That's
You
right.
assess your patients. But this is we're not in critical care patients. So
No.
thinking of it from that perspective, yes, you need to be trained in the area, but it could be an online training. It doesn't have to be so many
Got it.
different trainings. It should
Sure.
be commensurate to your level of experience, though. Like if they're doing
Understood.
advanced trainings, and I mean advanced Botox, which is like different, and you have no idea about that, that could
Yeah.
be a problem. And that's just when you if something ever happened, you don't want to be in a position
Right.
where they go through your stuff and they're like, okay, you're being audited, and you
Yeah.
don't know nothing they doing there. And so
Yeah.
that's the
That's right.
benefit
That's
of
right.
of working with a
Sure.
nurse, like me working with my client, is that I have his system built out. So we built out his
Understood.
system where
Got
he's
it.
still working less, but he's meeting the compliance requirements by the state, though, which is really important. So yes, I just wanted to add
Sure. Man, you said it, and I felt physicians tense up. When you talked about an exposed license, which would that risk of not being trained or knowing exactly what's happening with your nurse or nurse practitioner, but that
yeah.
can be mitigated. It's solved early with communication, with trust, with staying in contact, and with constant, often I don't want to say constant communication, but regular communication at least, and making sure that those things are in place early.
And can I say,
Go
with the
ahead.
healthcare system, if you think about it from the 30,000 foot perspective, and more abstract, right? Nurse practitioners work on their own, especially in primary care settings. The difference is the risk is on the healthcare system. So
Right.
there's always that. But there's a
Yeah.
risk with all of us, right? And so how do you
There is.
mitigate those risks?
There's.
The years of
Yeah.
experience they have,
That's right.
what
That's right.
how much training they have, right? So
That's
you
right.
still have to make sure you're making sure
Sure.
that they're in a position where they are
That's
trained,
right.
so that you can decrease the chance of
That's
any
right.
issues. But
Yeah.
no
Yeah.
risk, no
And
reward.
that's exactly right. Now, we talk money here at Doctoring Differently. So how much could a physician collaborator expect to make or earn monthly from such a collaborative relationship?
So in the state of California, physicians are technically only supposed to supervise 4 nurse
Okay.
practitioners,
Okay.
4 physician assistants, and
Okay.
believe it or not, an unlimited amount of RNs. And I
Yeah, I've
think
heard
the
of that.
rationale to that is it is the expectation that you will have more supervision over the RNs, and the NPs and
Understood.
PAs have more
Right. Right.
autonomy, right, as
Okay.
providers. And so, with that being said, the general range is it depends on the services they provide, because of course the more advanced the services, then the more the risk. And so you could
Right.
increase your partnership investment, because we don't pay
Okay.
for licenses here, right?
Right.
So
Right.
collaborate, may the cost may increase because you may be required to do a little more in the corporation. All right.
Okay. Okay.
So that can range anywhere between $800 to upwards of $1,200 a month per
Okay.
provider that you work with.
Per
And
provider.
so,
Got it.
yeah,
Got
so
it.
for my clients, I like to get them to 10, the magic number 10. I feel like
Okay.
if you can get to 10, and you're making 120K and you see how much value, because like I think big. So I already talked
Yeah.
to my guy and I'm like, listen, which is my client. I'm like, I want you to get licensed in other states.
Yeah.
Like we can leverage automations. We can
Sure.
leverage, like, I'm thinking about it from that perspective. But I
Understood.
also tell them, like, just, being able to generate that and seeing that you're not killing yourself doing it. Like, you know what
That's
I'm
right.
saying? Like, you're
That's
not
right.
sacrificing time with the people who matter the most. Like, that's what
Okay.
this is all about, right? So you want to do
Yeah.
it safely, but you can definitely generate good revenue by
Sure.
partnering with nurses and establishing, and you being the supervisor over the medical aspect of their business. So I have to be
Okay.
careful with my words.
That's right. No, I sense you're choosing your words very carefully here, and I think you've gotten the point across. At least to me, I understand what you're saying. That this is
Right.
not just license out there. Don't know who's working under it. I'm just getting just getting a check every month as a medical director. Which is, again, when I peep into some of these Facebook chat groups where physicians are talking about medical directors, that is the fear.
Yeah.
And of course, that is where you lose so many of us in the respect of this industry. And that's not what we are talking about today. That's not what this is. We are talking about an active collaborative relationship where we're sharing information, we're sharing knowledge, and there's accountability.
Yes.
Or is this provider, are these providers going over charts? Are they talking about, patients? How often are they
Are
talking
they meeting
about
with the so
clients?
in California it's 10%, but most state that they should audit charts, right? But in most
10%?
states,
Okay.
10% of charts for NPs,
Yes.
PAs. In most states, though, they just say a reasonable amount. They don't even tell you a
Yes.
number, right?
They
So what I
don't.
do is I always err on the side of caution. I'm like, if 10%
Sure.
is the most stringent, let's go with 10%. That
That's
way,
right.
CYA. But they don't. They
That's
say
right.
reasonable amount, reasonable this, reasonable. It's very,
Okay.
very like gray.
Yeah, I know.
And
I know.
so
I hear it.
and the best thing to do is just err on the side of caution. So a lot of people are, especially physicians, are afraid of this because they don't realize that the way our laws are created, it's like the legislative body decides, and then the attorneys try to interpret it. BRN tries to interpret it. The medical board tries. It's all these, and you guys know, everyone is subject to interpretation. It's gray. It's subjective.
That's right. It is.
So
it is.
just do
I
the
know
best
gray
you
can scare
can.
us though. We don't like, I know gray scares us though. We want black, white law, clarity. That's how we think. But you are right. And this whole space is interpretation, but it is safety, and it's using our intelligence and our license, which we both of our industries have. Scores of. So thank you so much, Dr. Jones, for coming on the podcast today. I so appreciate it. I'm going to close with a question I ask all of my guests. And that question is, did this current version of your career fall into your lap? Did it happen on its own, or did you take some action to make it happen?
I definitely took action. This is not passive, is to be comfortable. And I could have just stayed in my cushy job. Everyone told me I was making good money, right? So I could have done that, but I just had such a desire for more, but not just more money. Just forget the money. Impact. Impact. Like, I'm a leader by nature, but I'm also a teacher within. And so just to be able to get out and help others who have the same problem that I have get to their destination a lot quicker than I did and have the freedom in their lives, that requires activity. Period. And I mean, not just any activity. I mean, the activity that makes you very uncomfortable, where you're looking around like, what am I doing here uncomfortable?
That's right. That's
So
right. But
it's
active, and it sounds like it has been very worth it for you.
Yes, absolutely has. And then who you become in the process too is great.
That's right. That's right. Man, you're dropping so many great quotes on us today, and just like pieces I feel like our listeners will record and listen to again. So thank you again for coming on the podcast. We really appreciate it.